This is a quick podcast about end fields that you might encounter in clinical practice. Firstly, a definition. An end feel is the sensation that's imparted to the physiotherapist's hand when they are taking a joint to the end of its available range. As we always say, you need to know the normal before you can know the abnormal, so you do need to know what the normal end feels are for all of the main synovial joints in the body. In the next few slides, I'm going to run through some of the normal and some of the abnormal end feels that you can expect to find commonly in clinical practice. First of all, we're going to start with a slightly unusual one, which is elbow extension in a normal arm. This is actually a bony end feel, and it's one of the only examples of a bony block in a normal body, and that's elbow extension. The reason that we have this is that the ulna ends in a bone called the olecranon, and at the back of the olecranon, where there's this blue star, you can see there's a little lip of bone. When we extend the elbow, this engages with the back of the humerus, the posterior fossa at the back of the humerus. So in a normal elbow, there's a bony block to elbow extension. That's not the same for elbow flexion, which is usually limited by soft tissue approximation, the forearm against the biceps. We're now going to switch from one of the rarest to one of the commonest, which is a capsular end feel, which is obviously the name for the limitation caused by ligaments or capsules. And that's called a hard elastic end feel, or sometimes a leathery end feel, and that's certainly probably one of the commonest end feels in a normal body, and it's certainly common in the hip. If you can imagine getting a hold of a leather belt or a piece of cloth and pulling it, that's what it feels like. It doesn't come to a bony block, but it comes to a fairly abrupt halt. If a person has a loose body inside a joint, usually a meniscal fragment, this diagram here shows a bucket handle tear, that might cause a springy block because there's a mechanical obstruction inside the joint, and it literally feels like a piece of rubber bouncing inside the joint. This animation shows you a bucket handle tear and how it can actually flap around like the handle on a bucket inside the knee joint. So you can see how this would cause a physical obstruction to a movement. One of the more serious end feels is called an empty end feel. This is where you can't get to an end feel. The patient won't let you. The patient will be gesturing to stop or telling you to stop, or in so much pain that you can't actually get there. That's usually the sign of something sinister, something like a fracture or an infection or something like that. Sometimes it's not the joint itself that limits the movement, it's something around the joint. So in the case of this model who's doing knee flexion and hip flexion, in the case of her knee, it's going to be soft tissue approximation, so it's going to be the gastroc against the hamstrings, and if she pushed her hip into more flexion, it will be the anterior thigh against the abdomen. Sometimes excessive muscle spasm is the cause of limitation. Obviously that's an indicator that something is very painful or the patient's very apprehensive, and you should never force through spasm.